So where do you get supplies? You order them online. I mean, you can order everything else online, right? There's a store in Chattanooga called The Pouch Place. That's where I got mine. The first time I ordered, the home health nurse helped me order it. And they sent me this big box, and I had it's like a prescription for a medication. They give you a certain number for a month, assuming that you'll change the pouch every 2 to 3 days. So they give you supplies based on that number. And they gave me this nice little, it looked like a toolkit, real small, about this big, sort of like a wallet. And it had my scissors and my pen and my measuring thing, and I could put in one wafer and one pouch and one ring in that little thing, and I just carried it in my purse, just in case. So that was really nice. And then when it was time to order some more, I just called them up on the phone and told them I needed another set, and they would send it to me, and it would come delivered to my door. So that was really nice. You'll see pictures online, and in your book it talks about irrigating this bag and irrigating the stoma. Nobody ever taught me how to do that. And if you look at recent literature that's not in a textbook, nobody ever does that anymore. So that's not really a thing that you even need to worry about at all. I would just ignore that irrigating thing totally. A lot of patients, when they empty their pouch, they'll sit on the toilet and spread their legs and drop the end of that down into above the toilet. One of the places I read online said, put a little bit of toilet paper in the bottom, lay it across the top of the water so it doesn't splash when you drop the stool in there. Some people prefer to sit and do it like this in a container. It just depends on how you want to do that. Both ways work. Sitting down really is the best way, either on the toilet or in the chair.
You really get the best tips from the users.
Mm-hmm.
Yes, they've lived with it.
You do. Now, after I got out of the hospital, I had 4 home health visits from the home health nurse who helped me. They kept saying, oh, you're a nurse. And I kept saying, forget I'm a nurse. Pretend I never heard of this before. I want to hear everything. Everything you've got. And so she helped me a lot, but she was not an enterostomal therapist. So she didn't have all the little tiny tips that I learned. I actually had a friend where I used to work at Memorial Hickson who was an enterostomal therapist. And I'd call him up all the time on the phone. I'd say, Jerry, what do I do about blah, blah, blah? And he gave me a lot of tips. Okay, so the major complications that you're worried about, that you're trying to prevent, are that skin excoriation around the stoma. Like we showed that one picture. That wasn't really excoriation, that was irritation and probably fungus. This one.
That advancing army is what tells me it's fungus. See how out around the outer bit, it's like you have little bits.
Yes.
There.
It's trying to move. It's
yes,
on the move.
It's on the move. That's the
and
advanced
this whole
army.
shiny thing is not a good sign either.
No.
The excoriation is probably going to be right up next to the edge because the stool laid on that skin a long time. That's what the excoriation comes from. And do you think that would be more likely to happen with a colostomy or an ileostomy? Ileostomy. Because that liquid stool is harder to clean up and it's easier to get under things and around, and it's also a little bit more acidic. So the ileostomy patients have a little bit more trouble with that. Another complication would be emotional reactions. Certainly body image is important. You can go online and see pictures of young people your age who are wearing a bathing suit or something like that, and it shows their pouches or their stomas, and so those people hopefully have really good body image. There are models that have, professional models that have stomas. Family support is really important. When I was in the hospital for 10 days, That's not the normal length of time for a surgery like this, but I had some complications. And Mr. Rose was there every night. He never went home. He said, I'm not going home till you go home. So he'd go home, take a shower, get something to eat after work, worked every day, come back and sleep on that horrible couch in the room next to me. Then when I got home, my daughter came and stayed with me for 2 weeks because I was just exhausted. I was a wet noodle for energy. And she came home and she took care of me, and all I did was sit in the chair and go to the bathroom and eat, and sit in the chair and go to the bathroom and eat. And she took care of the house and me. She helped me do my colostomy care because I couldn't see underneath to the bottom of this to be sure it was clean. I mean, how can you get your head, unless you're a gymnast, how are you gonna get your head down low enough to see underneath? Unless you use a mirror or something like that. So she would always help me when I was sizing it and cutting it and making sure that it was at the right point. And initially, she actually did the colostomy care for me a couple times, changed the pouch.
That's a good daughter.
It is. I'm not giving her away to anybody.
Where
Yes.
did you get your psychological therapy? Would that be like from the therapist or the nurse side? Like the specialized therapist that you had, or like a nurse?
The intraostomal therapist would normally, and the home health nurse would normally do that as well for the patient. They really never talked to me about that kind of stuff. Now, I will tell you that one of the biggest signs you can tell they're having psychological trouble is if they refuse to look at it. And that's the big thing that intraostomal therapists use in the hospital. So, ma'am, are you ready? Let's look and see what, no, I don't want to see it. Or maybe they'll look at it, but they won't touch it. They won't take care of it. They won't learn about it. So those are signs that they're not psychologically progressing. And especially if it was a emergency, it's a surprise. I mean, you didn't know you were going in to get back and go home with it. So that would be one of the biggest problems with the psychological. I don't know if they thought because I was a nurse, and I mean, I started looking at it and taking care of it the first day because I knew I was going to have it, and I knew I wanted it done right. So I started taking care of it the first day. So I guess they just kind of assumed that everything would be fine. And for the most part, I didn't have a lot of body image trouble. The biggest one was the smell, like I told you before, and the OCD about the germs. So those were the two biggest things. And then nutrition is another possible complication, or not complication, but something you need to consider. What my surgeon told me was that he wanted me to have a tablespoon of citrusel fiber every day. And the reason was so that the stool would just continuously stay of good consistency and just keep coming out every day. And so that fiber keeps it from being too liquid and keeps it from being too solid. You can use it for both things. And so that's what he told me to do. And just sort of as an aside, the citrusel, which is the orange flavored, for some reason, he didn't explain to me, has less gas as a result of it than like regular Metamucil fiber. So I'm like, okay, give me the citrusel. Now, if you have a pouch like this, would gas be a complication? Now that's a normal function, normal body function. That's not a complication. But what are you going to do? I mean, it would puff this bag up big if you had. Sometimes mine did, really puffed up big. You could unseal it up here with the Ziploc seal and burp it like that. Sometimes I would just go ahead and empty it because there was stool in there as well, and I would just empty the air and the stool at the same time. Questions? Anything else you ladies want me to address?
You did a good job.
Did it like hurt very bad? Like the site?
The site, the stoma site, didn't hurt at all.
I never
The incision hurt.
Yeah.
And yeah, and then when I had the fungal infection, that hurt. But the incision is what hurt. But not the stoma opening at all.
before you got the fungal infection, were you using that skin prep spray or?
I
what?
did.
Okay.
I sure did, every day.
I've seen, or like I've heard about them like spraying and then using a certain powder and then like doing layers of it. Did you ever do anything like that, or did you?
So when I got the fungal infection, they gave me antifungal powder.
Okay.
And so I would spray a little bit, not very much, and then put the powder on and then let it dry. And then put another layer of powder and then let it dry, a couple layers of powder, however much I could get to stay on there.
Did the powder like affect it sticking very well? Or did you
It
just have
didn't
to let
seem
it?
to affect that at all. I was surprised. You don't want it caked up. It's just like ointment. When you do ointment of any kind for any reason, you don't need to glob it on. You just need a thin film, that's all you need. So that's what I was doing with the powder. Yes, ma'am.
And you said you can change the pouch like every 2 to 3 days. What about like the wafer and the ring?
The whole thing.
Okay.
The whole thing, yeah, every 2 to 3 days, more like 3 to 4, I guess, when I got a little farther on, everything comes off. And I always timed it when I was taking a shower. Because I wanted, and he said it wasn't a problem, just let water run over that. Now, would you put it like this, with the pouch hanging off the side? Not if you're gonna get the patient up. If the patient's gonna get up, you want that hanging down, straight down, so that when they stood up, it wouldn't flip over. If you did it like this, then it would go like that when you stood up, so you don't want that. But as a nurse, you're thinking, oh, let me just let it hang over here. It's not gonna work. Other questions? If you think of any later, feel free to ask me. I don't have a problem with that at all. Thank you very much. I get you to practice now.
Yeah, they do.